Our top story, a focus on Maharashtra, which is headed for a lockdown. A formal announcement and details are expected on Wednesday. The SOP and guidelines are still being worked out. But on Sunday, the Chief Minister met virtually with COVID task force to discuss measures, including imposition of the lockdown in a state to break the virus chain. And all members of the state's COVID task force were in agreement and of the view to impose a lockdown in the state, says the Maharashtra Minister Aslam Sheikh. On Sunday, in fact, Maharashtra reported over 63,000 cases, the highest ever.
लॉकडाउन लगना चाहिए था, इस विचार की तो पूरी टास्क फोर्स थी। अब किसी का कहना था कि 8 दिन होगा तो ठीक होगा। टास्क फोर्स में किसी ने कहा कि 3 हफ्ता होना चाहिए कम से कम तो एकदम कंट्रोल में आएगा। किसी ने कहा कि कम से कम 2 हफ्ते का तो होना ही चाहिए। तो ये सारी बातें जो है सबकी समझी गई है। इसके ऊपर जो फिर एक बार जो है कल रखी गई है मीटिंग, उस पर फिर कल एक बार विचार होगा और सारे विचार होने के बाद में क्या होना चाहिए, क्या नहीं होना चाहिए, क्या चालू रखना चाहिए, क्या नहीं चालू रखना चाहिए, किस चीज़ को जो है सख्ती से बंदी करना चाहिए, किस चीज़ में ढील देनी चाहिए और कब ढील देनी चाहिए, ये सारी चीज़ों की बातों पे भी कल चर्चा होगी और आने वाले दिनों में सारी मंत्रिमंडल में रख के मेरे ख्याल से इसके ऊपर विचार करके जो मुख्यमंत्री जी और मंत्रिमंडल निर्णय लेगा वो फाइनल होगा।
Chief Minister was always in favor of a lockdown, and even the task force members were in favor of a lockdown. But for how many days and what are the details of it, that is not yet known. In fact, in this meeting, that is what was discussed as well, that there is a shortage of oxygen, then ICU beds, and health infrastructure needs to be ramped up, and the supply of Remdesivir needs to be there up to mark. All these points were also discussed, and the Chief Minister, in fact, has asked the task force to come up with an SOP as to how to go about in the coming days. And in fact, tomorrow he will be discussing this with the Deputy Chief Minister Ajit Pawar, who is also the Finance Minister of the state, because the opposition BJP was of the opinion that when they had the meeting yesterday, they were of the opinion that if at all there is a lockdown, then the financial points need to be discussed as well. People need to be given financial aid, and those who will be losing their livelihoods need to be insured as well. So tomorrow here, Chief Minister and Deputy Chief Minister will be discussing, and then they will come up with a decision which will be conveyed to the Cabinet. The Cabinet is on Wednesday. So yes, most likely we can say that in the next 1 or 2 days, that formal announcement will come up very soon. But yes, most of the members of the task force and the Chief Minister himself is in favor of a lockdown.
Now, a viral video that highlights the scene at Mumbai's top multi-speciality hospital, Lilavati, which has set up beds in the lobby of the 8th floor near the lift to accommodate patients. Currently, there are 150 plus COVID patients in the hospital, and all beds are full, due to which the waiting list has also increased. The demand for COVID beds has increased, due to which they had to set up beds in the lobby after taking consent from the patients. In fact, Lilavati put out a statement as well, saying that they had converted the area into a COVID ward so they could give immediate treatment to the patients, that all the patients were informed and requisite facilities had been set up. Now, in Maharashtra's Osmanabad district, however, there is a shortage of beds, and it shows the dire situation of the healthcare infrastructure. Oxygen support is being provided to COVID patients at the district civil hospital, seated in chairs. So many of them can't even get a bed, so they're being seated in chairs and provided with oxygen relief. Now, 3 central teams that were deputed to Maharashtra, Punjab and Chhattisgarh earlier this week after a review of the COVID situation by the Prime Minister have pointed out multiple flaws in the handling of the situation by the 3 state governments. Overall, the teams had visited 50 districts, 30 in Maharashtra, 11 in Chhattisgarh and 9 in Punjab. Their reviews mentioned a multitude of issues ranging from lack of optimal use of healthcare facilities, lack of RT-PCR testing facilities, shortage of healthcare workers, and in one place, even a tax on healthcare workers. In all 3 states, there was a marked lack of compliance to COVID-appropriate behavior, is what the central team had noted. Now, even as we talk about the COVID crisis and the second wave, let's take a look at what's happening in Haridwar with the Mahakumbh underway. Lakhs of devotees from across the country have gathered for the Shahi Snan, which is taking place today at the Kumbh at a time when COVID cases are at an all-time high, and ensuring social distancing has emerged as the biggest challenge for authorities. Take a look at these visuals of the crowding on the ghats. Meanwhile, the Mahant Rajgiri, the head of the Akhada Parishad, has also tested positive for coronavirus and he has been isolated. NDTV's Akshay sent us this report.
Right now we are present at Haridwar at the ghats of Ganga river, and today is the second Shahi Snan of the Kumbh Mela. Lakhs of devotees have already arrived in Uttarakhand at Haridwar for this auspicious occasion, and right now you can see all the people who have came here to take dip in Ganga river. As far as the day is concerned, it has always been considered a very auspicious day, but in these times it is very important to see that how the management is taking place as far as Kumbh is concerned. According to the officials, Kumbh has always been a task for the authorities to manage, but this time it's even more challenging because of COVID-19, which has been spreading across the country like a wildfire even right now. Even as there have been certain SOPs that have been issued by the government, as far as the social distancing is concerned, it still remains an issue because as far as the official figures are concerned, in the last Shahi Snan that took place on 11th March on Shivratri, around 37 lakh devotees were present in Haridwar. Social distancing is not possible here. However, the authorities have given option to the people, stating that even if there is a huge gathering at one place, the devotees can go to other ghats as the relevance of taking dip in Ganga river remains the same or at all the ghats across Haridwar, and that they have been appealing to the people as well.
Now, on Sunday, India added over 1,52,000 fresh COVID infections, setting another grim one-day record. There have been as many as 839 deaths during that 24-hour period. And this as the government kicked off a 4-day-long Tika Utsav or vaccine festival to inoculate the maximum number of eligible people against coronavirus. But states are warning that they will run out of stocks for the vaccine.
India's COVID nightmare continues. Fifth consecutive day of recording its highest daily cases and over 1 lakh cases. 1,52,879 cases and 839 deaths were reported in the last 24 hours, the highest daily deaths since mid-October. And India's positivity rate has gone up almost 4 times in a month. The national capital recorded over 10,000 cases for the first time, its highest ever daily cases at 10,732. CM Arvind Kejriwal urged the centre to widen the vaccination net as 65% of the patients in Delhi are below 45 years of age.
दिल्ली में 10,732 केस पिछले 24 घंटे में आए हैं. 10,732 केस. कुछ दिन पहले तक मिड मार्च तक लगभग 200 से भी कम केस प्रतिदिन आने चालू हो गए थे. इतना कम हो गया था. मैंने केंद्र सरकार से कई बार हाथ जोड़ के निवेदन किया है, केंद्र सरकार को चिट्ठी भी लिखी है, प्रधानमंत्री जी को भी चिट्ठी लिखी है कि ये जितने रिस्ट्रिक्शन लगा रखे हैं वैक्सीनेशन के ऊपर, सब रिस्ट्रिक्शन हटा दीजिए. हम घर घर जाके कोरोना की वैक्सीन लगाने को तैयार हैं.
The record high comes on a day India started its nationwide Tika Utsav or vaccine festival to inoculate the maximum number of eligible people. The event goes on till 14th of April. Today, PM Modi also issued a statement on Tika Utsav and urged people to keep 4 things in mind. First, each one vaccinate one. Those who are less educated or elderly and cannot go and vaccinated, help them. Second, each one treat one. People who do not have the same resources or those who are less aware, help them in the treatment of corona. Third, each one save one. Wear a mask yourself to save yourself as well as others. Fourth, in the event of somebody testing positive for corona, the society should come together to create micro-containment zone.
प्रदेश के अंदर आज 6,000 केंद्रों में टीकाकरण का विशेष अभियान चलाया जा रहा है. 45 वर्ष से ऊपर का हर व्यक्ति जिसने अभी तक कोविड-19 से संबंधित इस वैक्सीन को नहीं लिया है वह अपने केंद्र में रजिस्ट्रेशन करवा करके इस टीकाकरण का हिस्सा बन सकता है।
फर्स्ट डोज लेने आया हूँ और मेरी अपील यही है, बुजुर्ग भी जल्दी से जल्दी लगवा लें और यंग बच्चों के लिए भी, उनके लिए भी अनिवार्य करें और जल्दी से जल्दी लगवा लें। ये बीमारी बहुत जल्दी सही हो जाएगी, इसमें मतलब कोई वो वाली बात नहीं, डरने की कोई बात नहीं है।
इसको और बड़े लेवल पे आप इसको करिए जिससे कि सभी लोगों को ये वैक्सीन मिल सके, चाहे वो यंग हैं और चाहे वो बुजुर्ग हैं। ठीक है, सभी के लिए हो सकता है यंग है उनकी इम्यूनिटी स्ट्रांग है, बट क्वाइट पॉसिबल थोड़े टाइम बाद कुछ लोग ऐसे हैं जिनकी इम्यूनिटी नहीं स्ट्रांग है।
The move to increase vaccination coverage comes despite 11 states flagging vaccine shortage. Maharashtra, Rajasthan, Punjab, Telangana, Delhi, Chhattisgarh, Odisha, Andhra Pradesh, Jharkhand, Assam and Uttarakhand. Even parts of Uttar Pradesh like Ghaziabad and Noida are facing diminished supplies. The centre, however, has constantly dismissed reports of vaccination shortage as misinformation and politicization.
Tika Utsav, or a vaccination festival from April 11 to April 14th has begun. This is an initiative by Prime Minister Modi, encouraging more and more people to get vaccinated and increase India's vaccination coverage. Even Chief Minister Arvind Kejriwal has said that once you get vaccinated, even then if you catch the disease, then the severity of the disease will be very less, and that is why I want all of you people to go ahead and get your jabs. In New Delhi with camera person Gauri Prasad, this is Sukirti Dwivedi for NDTV.
Now, India has banned the export of antiviral drug Remdesivir amid a surge in COVID cases. In an order, the government said it has banned export of Remdesivir injection and Remdesivir active pharmaceutical ingredients till the pandemic situation in the country stabilizes, as massive queues are being seen across the country with people lining up to get their hands on Remdesivir. Time for us to slip into a short break. Coming up on the other side, all the election news and the Prime Minister to hold 3 rallies today in Bengal. Welcome back. The Prime Minister will be holding 3 rallies today in West Bengal. He will be holding rallies in Bardhaman, Kalyani and Barasat. Now, the phase 5 polling for West Bengal elections will be held on the 17th of April. And on Saturday, during the 4th phase, 4 people in Kuch Bihar's Sitalkuchi were killed in CISF firing, pushing the Election Commission to bar the entry of politicians in Kuch Bihar for 72 hours. And not just the Prime Minister, Home Minister Amit Shah's roadshow will be taking place today in Kalimpong and Siliguri. He'll also hold public meetings at Dhupguri and Hemtabad. Bengal Chief Minister Mamata Banerjee will also be addressing some 3 to 4 rallies today. Now, after the poll panel restrictions, Mamata Banerjee spoke to the families of those killed in the Kuch Bihar violence and called the incident a genocide. Home Minister hit back, saying Mamata instigated the youth and women before the violence.
The Jorpatki village in Shitalkuchi mourning its dead. 4 of its sons gone on polling day to firing by central forces.
ভবিষ্যতে যে কি আমরা করব আমরা তো আতঙ্ক হয়ে আছি যে একজন সেই তার বিবি গর্ভবতী একজন ছোট বাচ্চা 3 বছরের সে কি গিয়ে আমরা কি করব
গরিব ফ্যামিলি রাজমিস্ত্রি কাজ করে খায় তাদের একটা 45 দিনের বাচ্চা আছে এখন এগুলোকে কে দেখবে সংসারের মধ্যে একদম উনি একদম কর্মিষ্ঠ
But even before the last rites were done, a fresh bout of political confrontation breaking out. Mamata Banerjee called the deaths genocide.
I said genocide because I know Nandikram genocide happened. This is also genocide. When you fire, the upper side, and without giving any alert, any alarming, any red alert or anything, or you did it try if there is anything. Nothing is there. It was peaceful, just good queue.
Amit Shah stirred the appeasement pot, claiming Mamata Banerjee had only mourned the minority victims of the CISF firing and not the death of a Hindu youth killed in a political clash also at Shitalkuchi on the same day. Trinamool locked horns.
दीदी, आप ये 4 लोगों के लिए तो आंसू बहाती हैं, हाय तौबा करती हैं, कार्यक्रम छोड़कर वहां जाने की बात करती हैं। मगर मैं उनको पूछना चाहता हूं कि 5वां जो कार्यकर्ता मर गया भारतीय जनता पार्टी का, इसके लिए आपकी कोई जिम्मेदारी नहीं है क्या?
এটি মিথ্যা 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 অমিত শাহ জেনে বুঝে এই মিথ্যাচার করছেন এবং একটা সাম্প্রদায়িক উস্কানি দেওয়ার চেষ্টা করছেন। অমিত শাহ বা মোদি এই 5 জনের নাম বলেছেন কি?
That was not all. As Amit Shah went on a roadshow spree and Mamta Banerjee on a wheelchair padyatra, BJP's Dilip Ghosh warned of more Sheetal Kuchis if the TMC tried underhand means on the next polling dates. TMC has called for his arrest.
Central Force বুথে থাকবে, কেউ লাল চোখে দেখাতে পারবে না। তাহলে আমরা আজ যদি বাড়াবাড়ি করে শীতল কুচি দেখেছেন কি হয়েছে, জায়গায় জায়গায় শীতল কুচি হবে, সেই জন্য সাবধান থাকুন।
জায়গায় জায়গায় শীতলকুচি হবে। সিপিএম নেতাই নন্দীগ্রাম করে পরিণতি কি হয়েছিল দেখেছেন তো? আপনারাও অনুবীক্ষণ যন্ত্র দিয়ে আগামী দিন খুঁজে পাওয়া যাবে না, মানুষ বুলেটের জবাব ব্যালটের মাধ্যমে আগামী 17 তারিখ দেবে।
Banned from entry there today, Mamta Banerjee will go to the Sheetalkuchi village on 14th April. Sheetalkuchi has scarred Bengal. The wound, unlikely to heal before 2nd May and sure to cast a shadow over the 4 remaining phases of the Bengal elections. In Kolkata, Monideepa Banerjee, NDTV.
Now, post-election developments from Assam after the All India United Democratic Front, the other Kiala in the Congress-led Mahajot, Hagrama Mohilari's Bodoland People's Front or BPF have also sent away at least 10 of their candidates from Assam, fearing chances of horse trading. Let's go across to Ratnadeep for more on this. Ratnadeep, what are the details?
That's right, Gargi. In fact, this development has taken place in the last 2 days. That's what we have been given to understand by top BPF leaders. Now, they have confirmed to NDTV that at least 10 of their candidates have been are out of Assam. They are saying that they have gone for a leisure trip because they wanted to relax after hectic campaigning. But what we are picking up from party sources is that they have been actually moved to what party is claiming to be safer location. They have not disclosed to media where the location is, but they have been taken out. Now, remember, there were 12 candidates from BPF who have contested in 12 seats which are in the Bodoland region. And just before the 3rd phase of polls, the BPF candidate from Tamulpur actually switched over to the BJP. So that led to a commotion. In fact, there were letters sent to EC as well as a petition filed at the Supreme Court as well. So the BPF is clearly taking no chances. Earlier last week, we saw that Badruddin Ajmal UDF had moved its 18 candidates to the Fairmont Hotel in Rajasthan. We are also hearing that at least 3 Congress candidates have been moved to the same hotel, although there is no official confirmation from the Congress on this. But remember, AICC had made it clear that they would not like to take chances, given the fact that there is a sense in the Mahajot that they might be at a striking distance of actually forming the government. So that's why the Mahajot really not taking chances.
All right, Ratnadeep, well, stay with us for the next story as well. And in Dibrugarh, the police have busted an illegal Aadhaar card racket in the Paltan Bazaar area. 3 people have also been detained in this connection. Ratnadeep, give us the details.
This is a very interesting development and very important as well. Yesterday in a raid, the Dibrugarh police actually busted an Aadhaar card racket. 3 young men aged between 27 to 30 years have been picked up. They were all from the neighboring Lakhimpur district. Now, the most interesting thing that the police is saying that they had received complaints, and when they raided the place, the rented house where these people were running this racket, they have seized laptops, desktops, Aadhaar card forms, and scanners, all the electronic devices that you usually see in a Aadhaar card center. are there with them. So that is very is a real concern. And the police also has added that while these people have been arrested, investigation is on. There would be a larger probe in terms of whether they are part of a larger statewide network, given the fact that Aadhaar enrollment has been a key concern in Assam.
All right, Ratnadeep, thanks so much for joining us with those details. Now, a special interview with the Principal Scientific Advisor to the Prime Minister on the process of the vaccination at a time when several states have said that vaccines are running out. Direct questions and straight answers from Dr. K. Vijayaraghavan, a key member of the government team formulating and implementing the policy on COVID.
Dr. Vijayaraghavan, we keep highlighting the number of vaccinations that we are doing. And that's, I mean, the numbers are phenomenal. There's no doubt about that, even though it may take some more time to get where we want to get. And I don't think anybody is denying that. But what about universal vaccination, in other words, adults? And I ask this because there is a certain context even today with the Delhi Chief Minister saying, look, open it up for all adults. We'll go from door to door to door and we'll do it. Now, obviously, there is a supply side problem. But what are your views on opening it up to 18 plus adults?
A very hypothetical question. When the key aspect of vaccination for the country and for the world in general is equity and access. It's not, theoretical statements about whether everyone should have the vaccine or only someone should have vaccine. Equity and access means when you have a certain number of vaccines in a certain time period, you see where it is needed the most and roll it out.
In 1 month, since we've seen the skyrocketing number of cases, why do we still not have a precise fix on the strain that is causing all of this? Because clinically, so many doctors across the country have suggested that this is more transmissible.
Why do you think it's the strain which is cause of the rise alone?
Is it not a different strain?
There are multiple components which go into a rise, and we shouldn't pin ourselves down onto one or another explanation. It's the virus and its variants that could be important in some contexts. It's a behavior which could be important in another. It could be the number of people who have already been exposed in a population, which is a third. It could be the extent of vaccination in a country, which is the fourth. And all these are multiple parameters which are very complex. So the reason why I'm pointing out this issue about the variant, and variants are important and they could have an important role, is it's worrying to blame the rise on something which is not in our control. We must keep in mind that the virus is transmitted through humans, and human behavior therefore plays a very important part no matter what the strain is. And that should be our focus right now. While strains are important and understanding their biology is important, and while that is being done, because it's important to know whether they are immune evasive or vaccine evasive, and what to do and to what extent, to just say that we will wait for that and it's something to do with the strain is not the correct thing to say, without saying that our primary focus now needs to be on our behavior and make sure that it's appropriate.
That said, sir, how soon before we get this answer? Again, because we want to know how effective our existing vaccines are to these strains.
But we do have that answer. We do know that the different strains circulating around the world have elements of immune evasiveness and increased transmissibility, and yet they are not vaccine recalcitrant yet, particularly against severe or very high level of morbidity. And therefore, it's important to keep in mind that as that data comes in more about hospitals and patients and how much of them are infected by various strains, and that's coming in, we are actually on reasonably good ground right now. Scientists all over the world, including in India, are also working at intense speed to make new vaccines against new variants. So even though that the escape is rather modest right now, should there be a more stronger escape variant or a lineage which emerges, we are going to be prepared for that.
Now in Kerala, an Instagram reel, a video of two medical students, Naveen Razak and Janki Om Kumar, received a lot of love and encouragement after they posted a 30-second clip of them dancing to Boney M's cult song Rasputin. But amid all the appreciations, the video also received some hate comments from users drawing attention to their religion. Here's how they responded.
This dance by two medical students, Naveen and Janaki from Thrissur Medical College, not only went viral, it has inspired literally a dancing movement against hate.
This was such an impromptu attempt. We did it just after the class one day, just spontaneously within 2 hours.
We never expected this to happen. We just wanted to share it on my Instagram handle, and the other things were totally unexpected.
Trouble began when some people found out the surnames of the new dance sensations and started trolling them over religion. Well, the dancing duo refused to comment verbally against hate, saying they wanted to focus on the widespread love. But what they did was dance their way against hate, joined by many, many more. This was their answer to the hate. Fellow students from Vikings, their dance group at Thrissur Medical College, danced to the same popular number with a tagline on their social media post that said, "If you decided to hate, we've decided to resist." The same song, the same dance, the same swag, and more kept joining, with even online dance video challenges launched by various student bodies across colleges like #Rasputin Challenge, #StepAgainstHate, to #StepAgainstCommunalism.
SFI COSAT is organizing this dance competition in Indoor Pandikid in solidarity with Janaki and Naveen, who were subjected to hatred and gross effects of communalism. This is a protest through art.
The communal hatred, the more poisonous. The communal hatred they have received, being from two different communities, they shouldn't dance together. So IMMSN strongly condemns both these statements. And we have started the Rasputin Challenge as a protest to these statements.
Not just students. After the Kerala Cooperative Milk Marketing Federation, Milma, embraced the dancing duo in their post, Kerala government was inspired by the new popular dancing duo to promote COVID vaccination. May the dance for the cause continue. Sneha Koshi for NDTV.
In other news now, a public library maintained by a 62-year-old daily wage labourer in Mysuru was allegedly set on fire by unknown people on Friday. The library had over 11,000 books, mostly in Kannada. It has now been razed to the ground, but there's been help from unexpected quarters. Take a look.
A sewage cleaner's dream of educating his neighbours in Mysuru reduced to ashes. Syed Isaac, a 62-year-old daily wage earner, maintained this public library of over 11,000 books in a shed, stocking religious texts like the Bible, Bhagavad Gita, Quran, mostly in Kannada, until Friday when the library was set on fire.
ये पब्लिक लाइब्रेरी इसे जलाकर राख कर दिया गया है। ये लाइब्रेरी पब्लिक लाइब्रेरी 1/1/2011 से चल रही है। यहाँ सब मजहब की किताबें हैं, 11,000 किताबें हैं।
Isaac, who has filed a complaint with the police, suspects it is the work of an anti-Kannada group.
जरा जने कन्नड़ा को जो नफरत करते हैं वो लोग इसे देख को वक्त देख को इसे जुमेरात की रात को अंगार डाला है। ये पूरी जल को राख हो गई। एक जगह में पब्लिक लाइब्रेरी होना, मैं आज रहता हूँ, साबान रहता हूँ कि नहीं की तो यहाँ की वो लाइब्रेरी होना को तो यहाँ 90 पैसे गरीबा हैं।
After a lifetime of cleaning drains, this 62-year-old's library and his passion for education made him a popular figure in Rajiv Nagar area of Mysuru.
जो भी होता है खुदा की तरफ से ये अच्छा होता है। यहाँ इल्म होना जरूरी और APJ अब्दुल कलाम एक बात बोल को है, 1 बेस्ट बुक इक्वल टू 100 गुड फ्रेंड। 100 आदमी की दोस्ती करो धोखा देती, लेकिन ये किताब की दोस्ती करे तो कभी भी ये नहीं धोखा देती।
Looking at his plight and after the tragic incident, some good Samaritans on social media have come forward to help Syed and have already raised at least 13 lakh rupees. Syed himself is very determined to rebuild the library all over again. In New Delhi with camera person Ashwini Mehra, Shanakshi Chakravarti for NDTV.
Hello and welcome. You're watching Good Morning India. I'm Gargi Rawat. Our top story focus on Maharashtra, the worst affected state in this pandemic. Maharashtra is heading for a lockdown. A formal announcement is expected on Wednesday. The SOP and guidelines are still being worked out. But on Sunday, the Chief Minister virtually met with the COVID task force to discuss measures, including the imposition of a lockdown to break the virus chain. All members of the state's COVID task force were in agreement and of the view to impose the lockdown, says Maharashtra Minister Aslam Sheikh. On Sunday, Maharashtra reported over 63,000 cases, which is the highest ever.
इस विचार की तो पूरी टास्क फोर्स थी. अब किसी का कहना था कि 8 दिन होगा तो ठीक होगा. टास्क फोर्स में किसी ने कहा कि 3 हफ्ता होना चाहिए कम से कम तो एकदम कंट्रोल में आएगा. किसी ने कहा कि कम से कम 2 हफ्ते का तो होना ही चाहिए. तो ये सारी बातें जो है सबकी समझी गई है. इसके ऊपर जो फिर एक बार जो है कल रखी गई है मीटिंग, उस पर फिर कल एक बार विचार होगा और सारे विचार होने के बाद में क्या होना चाहिए, क्या नहीं होना चाहिए, क्या चालू रखना चाहिए, क्या नहीं चालू रखना चाहिए, किस चीज़ को जो है सख्ती से बंदी करना चाहिए, किस चीज़ में ढील देनी चाहिए और कब ढील देनी चाहिए, ये सारी चीज़ों की बातों पे भी कल चर्चा होगी और आने वाले दिनों में सारी मंत्रिमंडल में रख के मेरे ख्याल से इसके ऊपर विचार करके जो मुख्यमंत्री जी और मंत्रिमंडल निर्णय लेगा वो फाइनल होगा.
And a video that's gone viral which highlights the scene at Mumbai's top multi-speciality hospital, Lilavati, which has set up beds in the lobby of the 8th floor near the lift to accommodate patients. Currently, there are 150 plus COVID patients in the hospital and all beds are full, due to which the waiting list has increased. A demand for COVID beds has increased, due to which they had to set up beds in the lobby after taking consent from the patients. In fact, Lilavati put out a statement saying they had converted the area into a COVID ward so that they could give immediate treatment and relief, and that all patients were informed. Requisite facilities were also there. And in Maharashtra's Osmanabad district, it shows the dire situation of healthcare infrastructure. Oxygen support is being provided to COVID patients at the district civil hospital, seated in chairs, as the hospital has run out of beds. So there you can see COVID patients being seated on chairs and being given oxygen support. Meanwhile, the central teams deputed to Maharashtra, Punjab and Chhattisgarh earlier this week after a review of the COVID situation by the Prime Minister have pointed out multiple flaws in the handling of the situation by the 3 state governments. Overall, the teams had visited 50 districts, 30 in Maharashtra, 11 in Chhattisgarh and 9 in Punjab. Their reviews mentioned a multitude of issues ranging from lack of optimal use of healthcare facilities, lack of RT-PCR testing facilities, shortage of healthcare workers and in one place even a tax on healthcare workers. Well, let's go across to Purva now for more. And Purva, the central team, of course, giving its report on the handling of the coronavirus situation by Maharashtra. But now it seems clear that Maharashtra is heading for the lockdown. We're waiting for the details on Wednesday.
Well, in fact, today is going to be another crucial meeting between the CM and the Deputy CM, Ajit Pawar, where, CM and Deputy CM will be working out how to go about, especially the financial part of it, because even Ajit Pawar is also the finance minister. So they will be chalking out, what financial aid they can give. And because if at all the lockdown is implemented, which is most likely the case, then there will be a loss of livelihoods, and to compensate that, to ensure people who will be losing their livelihoods, what are the details that the state can do. For that, there is a meeting with the CM and Deputy CM at 11 a.m., which will also give out more clearer picture. And going ahead on Wednesday is when the cabinet meeting is there, and most likely the decision will be first conveyed to the cabinet and then it will be conveyed to the state of people. But yes, most likely the lockdown is where the state is headed, because the COVID task force, entire COVID task force is of the opinion that a lockdown is something that is inevitable now, because the cases are rising every day. Despite the weekend lockdown, yesterday we saw 63,000 cases come in just 24 hours. So that is just going up every day in district after district. Every district is reporting dire situations, no hospital beds, no ICU beds. So definitely everyone is of the opinion that to break this chain, lockdown is something that is inevitable. Yes, the formal announcement is to be made, but the decision between the members is almost done.
All right, so Maharashtra, they're headed for a lockdown. Thanks so much, Purva, for joining us with those details. But now some breaking news coming in on how this coronavirus second wave has impacted the Supreme Court. 50% of the staff at the Supreme Court have got infected with coronavirus, and now all judges in Supreme Court benches will assemble from their residences through video conferencing. Let's go across to NDTV's Vaidya for more details. Vaidya, give us the details. And 50% of the staff at the Supreme Court affected by COVID.
Yes, Gargi. Actually, sources have told NDTV that around 50% of the staff got infected and some are taking treatment. As for the judges are concerned, some judges had earlier infected with COVID, and some judges have taken a long leave. After that, they have recovered. So far, I know, I think no judges right now affected. All are working. But the point here is, now what happens? The Supreme Court bench starts at 10:30. Some benches start at 11. Now, from today onwards, so the 10:30 bench will sit at 11. The 11 a.m. the benches which is supposed to sit, that will sit at 12. So 1 hour gap has been given, and just to facilitate so that not much hearings takes place. And secondly, see, right now what happens is from Tuesday to Thursday there seems to be a hybrid hearing. Hybrid hearing in the sense it can be virtual as well as physical if the advocates come. So now they have said that all the judges will work from their home through video conferencing. For the hybrid hearing which the Supreme Court formulated, no advocate was filling, so this hybrid hearing is almost a failure. That's why the judges will sit from their homes. It's a huge impact on the Supreme Court functioning. Yes, anyway, we'll have to cope with it.
All right, Vaidya, thanks so much for joining us with those details. So half of the staff at the Supreme Court infected with coronavirus. Now, for the first time since the COVID vaccination drive began, Delhi vaccinated over 1 lakh people in a day on Sunday, the first day of the nationwide Tika Utsav. Well, let's go across to Sukirti now, who joins us from a vaccination center. Sukirti, give us the details. And yesterday, over 1 lakh vaccinated in the national capital.
Well, yes, this is definitely a record for Delhi, which vaccinates for at least the last 1 week. We've been carrying out about 80,000 vaccinations per day. But yesterday, there were over 1 lakh vaccinations which took place. Now, there are about 739 or so permanent vaccination sites already in Delhi at private as well as government hospitals. Apart from that, several temporary vaccination camps are also being set up at workplaces. For example, yesterday it took place at the campus of the IGNOU University for their staff. It took place at the Lee Meridian Hotel in Delhi. There, the hotel vaccinated about 140 of its staff members. Many more expected to get their vaccinations in the upcoming days. So that is what is leading to the boost in numbers. If we look at the countrywide scale, then we vaccinated over 10 crore people by now, and or 10 crore doses have been administered by now. And yesterday we ended up vaccinating about 27 lakh people by 8 p.m. Usually that number on Sundays is about 16 lakh. So a big jump there. So Tika Utsav that the Prime Minister initiated would have been a good start as far as the initial numbers are looking like. But of course, if you compare it on a global basis, then India is behind many other countries who vaccinated much bigger chunks of their population in terms of doses administered per 100 people. India is still running behind.
All right, Sukirti, thanks so much for joining us with those details. So a good record there by the national capital in terms of vaccinations. Well, let's now focus on Uttar Pradesh, where 15,353 new cases were reported on Sunday, which is the highest figure yet for the state. In fact, in capital Lucknow, 4,444 new cases were reported as well. And now new restrictions have also come in. Let's go across to Alok for more on this. Alok, tell us about the new restrictions that have been announced.
Well, some of the new restrictions are that schools and colleges have been shut till the 30th of April. These are schools actually, all schools from classes 1 to 12 have been shut, whether they are private or government schools. The UP government though has said that any examinations that were pre-scheduled can take place. Earlier what had happened was that the powers of night curfew, applying a night curfew in any district was delegated to the district magistrate, but yesterday the government has taken a call that what they're going to do is that they're going to apply a blanket night curfew in any district that is reporting 100 fresh new cases on any day, or which has 500 plus daily, which has 500 plus active cases. So that's the call that has been taken, and after that we've got a lot of reports from even the smaller towns and cities, like for instance Rai Bareli and other places where authorities have imposed that night curfew, Unnao, many other places that I can think of. What they've also done is that they've restricted people in religious gatherings to 5 at a time, and I think that has come after those really crazy pictures that we have been reporting on, especially from Mathura most recently, where there were huge crowds thronging to the Bake Bihari temple and other temples. And then of course you had these earlier pictures that we reported on from Prayagraj and Varanasi, where holy celebrations were massive with crowds without social distancing and without masks. And incidentally, both cities now are, or both districts now are reporting 1,500 plus cases. That's what they've reported yesterday. So all of these curbs are in place. The worries remain. I mean, these are Uttar Pradesh's highest numbers. We've overtaken even Chhattisgarh, which was reporting a huge caseload in the last some time. So yesterday's figures overtook that. So worries on multiple counts, and I think it's it remains to be seen how the authorities are going to tackle it.
All right, Alok, thanks so much for joining us with those details. So a maximum number of cases they reported in UP in a single day, and new restrictions also in place. Let's now focus on Gujarat, where because of harrowing tales, the Gujarat High Court has flagged the COVID emergency on its own, even as the state government claims the situation is under control. Through an oral order, the Chief Justice Vikram Nath directed the High Court to register a fresh suo motu PIL in reference to the uncontrolled upsurge and serious management issues in COVID control. The Gujarat High Court initiated this, observing that the media reports on the pandemic indicate that the state was heading towards a health emergency of sorts. Through an oral order, the Chief Justice directed that the PIL be registered, and also he said it's not just 1 or 2 cases but several reports that are coming out about the COVID crisis in the state. Remember, the first PIL on this issue was registered last year. It's still being heard at regular intervals. On Sunday, India reported over 1,52,000 fresh COVID infections, setting another grim one-day record. There were as many as 839 deaths during that period. Today, the numbers are expected to be even higher, with Maharashtra, Uttar Pradesh, Delhi all reporting the highest daily cases last night. Those numbers will be collated and released by the Health Ministry in a short while from now. Also in Gujarat, the High Court has taken up the crisis on its own. Well, to talk more about the situation, this crisis and second wave that we're seeing across the country, we're joined by Dr. Sameer Dani, cardiologist, Director, Department of Cardiology at the Polo Hospital, Ahmedabad; Dr. Rakesh Verma, Additional Director General of Health Services, Government of India; and Dr. Padma Srivastav, Chief Neuroscience Center at AIIMS, somebody who'd even volunteered for the COVID vaccine trial. Thank you all for joining us, and I'd like to start with you, Dr. Sameer Dani. If you could tell us, what is the situation in Gujarat? What are you hearing? Because now we believe the High Court in Gujarat has taken up the crisis on its own, given the kind of reports that are coming from across the state.
Yes, the situation in Gujarat is grim. It is serious because the number of COVID cases have risen exponentially, and that is the reason why the healthcare system has been put under, I think, greatest strain that it has ever come into. Probably during the whole year, hardly there was a time which was worse than this. But at the same time, now many private hospitals have joined in. So I hope that number of beds will increase and that will ease out the situation a little. There is no more shortage of the injections like Remdesivir and other drugs. So let's hope and see how this turns out.
Right, Dr. Rakesh Verma, a massive crisis across the country in many of the states. Of course, Maharashtra heading towards a lockdown, UP reporting the highest daily cases ever, Delhi as well. And it's really time for everyone to come together to fight this crisis. But somehow, that doesn't seem to be happening.
Gargi, the government is doing maximum that government should do. And government is fully aware of its responsibility at all the levels of the government. And I assure you the government hospital, whether it's state government hospitals or central government hospitals, are fully equipped. I want to reassure the population at large through your important channel that government is fully equipped, fully prepared to meet any contingency whatsoever without any fail. No patient will be turned back. No patient will be without treatment. But the onus is all on all citizens of the country that they must realize that this fight against the COVID is fight for not for government, not for me and you, but each and every citizen of 140 crores population that country has got. I really want to tell them that use of regular mask, a very good quality mask, if one not one, two, is almost mandatory. And now with the resurgence of second wave, we must use the mask even at home because we do not know which 5, 6, 7 members is partially infected or infected, could be contagious. Secondly, when we go out, we must take the social distancing norm to full extent. Do not look at the face, do not cough in the face. If somebody is coughing, avoid that guy. If somebody is sneezing, avoid that guy. Give up the habit of using a finger and picking the nose. If we sanitize and clean our hands regularly every interval at the moment you touch a new surface, please, these are the precautions which are mandatory. They were mandatory in 2020 and they had to be more enforced in 2021. Please. And that is the biggest
Rakesh Verma, you're talking about how we're prepared for this, and it's been a year of us dealing with this pandemic. We saw the last time when we had the wave of COVID, the situation in hospitals, and again, we're seeing this in various parts of the country. It's difficult getting beds in Mumbai, even in Delhi and Gurugram. You hear reports of people trying to get beds. It's taking hours. In Madhya Pradesh, you had a situation in which 2 patients died as the families were waiting outside the hospitals. In other places, you have patients lying around outside. Those visuals are there from Gujarat, and in Maharashtra as well. There are no beds. Patients are being made to sit and being administered oxygen. So really, we're once again seeing those scenes that we didn't expect to see. We would have imagined we'd be better prepared now.
Undoubtedly, you see the government's policies making 1 medical college in each district of the country, and now there are certain districts where more than 5 medical colleges in the district. The quality of medical care, the quality of medical health delivery systems are better in the teaching institutions as compared to non-teaching institutions. That is the motto behind the government's policy of developing a medical college in every hook and corner of the country. That's why government has created more than 20 new All India Institute of Medical Sciences and is definitely in the right step, in the right direction. As the time will evolve, you will see the healthcare delivery system and preparedness of the government and the hospitals where there are key primary,
so that does sound like a long-term plan. I'd like to go across to Dr. Padma Srivastav. And Dr. Padma Srivastav, on one hand, yes, the health ministry is talking about the public and how we all have to follow these COVID protocols, etc. But on the other hand, we have these massive gatherings. We have rallies taking place in Bengal today. There are going to be 3 big rallies. The Prime Minister is going to be addressing them. In the Kumbh, there's the Shahi Snan taking place today when lakhs of people are going to gather there. So it really seems to be a sort of dichotomy in the sense on one hand, we're told the public is to blame, they have to follow certain protocols, but on the other hand, it's just business as usual. So that sort of concentration on dealing with this crisis doesn't seem to be there.
Yeah, you're right, Kage. In fact, I guess there is
there's something called a critique and there is something called a criticism. So we probably can criticize how it is, and actually we're looking at this at 100 years apart. What happened with Spanish flu is exactly what is happening now, 100 years later, with all those kind of humongous advances in every field that we have. And as Professor Rakesh Verma had said that, yes, it is a citizen's responsibility. It is also a responsibility of the administrators, responsibility of those implementers everywhere. So it is holistic responsibility. It is not one person's. And as you rightly said, that there is a dichotomy that the business as usual, and we also want to impose these kind of restrictions. Said that though, the virus will not obviously respect geographic barriers. It doesn't need a visa to transfer across geographic barriers. So if we say there are pockets wherein there is a huge upsurge, it's because there's a lot of population there, there's a lot of travel and movement there, and there's a lot of testing there. So those areas where probably population is very less, they're fast spread out and probably not getting tested, we're not seeing those. So unless we believe that in those areas where there is an upsurge, that the need is met in terms of health delivery and prevention, we cannot say that we are prepared or we've learned. So this is a responsibility that all of us do, share. And I guess when you say that please use MSD as your most important vaccination program of mask, sanitizing and distancing, and at the same time allow things to happen as they are, then there is definitely a dichotomy. Said that though, I think we all went into, when there was a lull, there was this belief that probably we tided over the crisis. Now all of us believe that we have not. We've come back. But I'm sure, Gargi, this shall also pass. But we have to learn from these kind of issues so that we don't head for another thing happening after the second wave. Because remember, 100 years earlier, there was also a third wave. So in fact, the trajectory
in fact, many have pointed out that the signs were there in February as the numbers started slowly going up. The R factor was going up. Very quickly, Dr. Samir Dani, there are reports also in Gujarat that the death numbers, may not be correct because the government has adopted a policy that if somebody who has COVID dies of a heart attack, they are counted not as a COVID death. If you could tell us about that.
I'm not too sure about the numbers, what the numbers are, because it is so difficult to assign a cause to a death which happens outside the hospital. And nowadays, when a person dies at his house, who will certify how he died when you do not have any testing method, or when the tests have not been done, or the tests have been even hidden? So for the government to come out with exact number is very difficult. So I think when you talk about the deaths which are certified, which are certifiable due to COVID, these are the deaths which occur in the hospital. The rest of the deaths which occur outside the hospital are very difficult to give any cause to.
All right. Well, we'll leave it there.
That is why the disparity.
All right, we'll leave it there. Thank you all for joining us on NDTV as we continue to report on this crisis. India dealing with the second wave of coronavirus. In fact, as we've all been pointing out, the second wave is even higher than the first wave. The crisis is even more severe. Time for us to slip into a short break. We'll get you more on the other side. Stay with us. Battle for states, and currently it's only the battle for Bengal. 4 phases of elections are done, but there are another 4 phases to go. At the halfway mark, the battle for Bengal is intensifying. Let's go across to Monideepa now for more. And Moni, today the Prime Minister is going to be addressing not 1, not 2, but 3 rallies in a day in Bengal.
That's right. Past the halfway mark, all the star campaigners seem to be stepping up, their presence here in Bengal. Usually the Prime Minister would come and, address 2 rallies a day. But today it has gone up to 3. Mamata Banerjee also will be addressing 3 rallies. One of them in Kolkata. Prime Minister also quite close to Kolkata at Barasat. And then there are all the other star campaigners who are coming in and visiting constituencies is going to the polls on the 17th and beyond. So they are not just, campaigning for the 5th phase, but for the 6th, 7th and 8th as well. And remember, this time round, the silence period for the 5th phase has been increased to 72 hours. So that means, campaigning time is shorter than was expected. And therefore, even Rajiv Gandhi, we are being told, is coming into North Bengal on the 14th for 2 rallies. But in the meantime, much debate about what Mr. Dilip Ghosh of the BJP has said. He has talked about how Sheetal Kuchi may be repeated in several other places. Sheetal Kuchi, where 4 people were gunned down on polling day Saturday by central forces. Mr. Dilip Ghosh's context was, if naughty boys or bad boys, or clearly suggesting the Trinamool Congress, if they tried to disrupt polling, if they tried to bully people at the polling booths, the CAPF would be present, so would the BJP. So people should vote fearlessly, or else, who knows, he said at a rally in Kolkata yesterday, many other incidents like Sheetal Kuchi would happen. This has brought out the Trinamool a very angry reaction. Shukhendu Shekhar Rai demanding his arrest, Mr. Ghosh's arrest, for provocation, criminal provocation, he called it. This was last evening, and late last night, Trinamool has actually written to the Election Commission saying action should be taken against Mr. Ghosh and he should be barred from further campaigns. But he is up in Farakka today campaigning for his party.
All right, thanks so much for that, Monideepa. We're going to have to turn away from all the political news to get you the latest COVID numbers that have just come in, and it's the highest surge ever. We've been saying that every day, but today it is 1,68,912 cases of coronavirus in the last 24 hours. 904 deaths have been reported during this period. It is for the 6th day that India is reporting over 1 lakh daily cases. So a massive crisis across the country. The COVID numbers simply climbing. And this is the highest, remember, we've ever seen. In fact, in the first wave, we didn't even cross the 1 lakh mark. Now, for the last 6 days, we've been over 1 lakh, and now it's inching towards, God forbid, the 2 lakh mark, with 1,68,912 cases of COVID being reported in the last 24 hours. Let's go across to NDTV, Sukirti for... All right, well, let's go across to the doctors who were with us in the earlier segment and when we were discussing this crisis. And Dr. Samir Radani, first to you, the numbers are climbing even higher, 1,68,000 cases being reported in the last 24 hours.
Yes, it's an alarming number, and the numbers are on the rise. But the important thing is not to panic and handle it efficiently. I would like to emphasize what City of Ahmedabad has done recently, and that is providing home care to affected people who are exhibiting mild symptoms, so that hospital beds are not, overflowing. And we have a system where so many home care teams are circulating around the city, providing home care to people, giving them micro-containment. And I think in future also, as the numbers continue to rise, they may rise still further, and then probably this is the way to go.
All right, but the worry this time is it's not just in the cities. We're seeing a lot of cases in rural India as well. If you talk about Gujarat, Maharashtra, UP, Dr. Padma Srivastava, a massive crisis, and we really need, administrations, centers, state governments, local administrations to really throw everything at containing this crisis.
Absolutely. And in those areas which are supposedly more pristine and have less number, as has been said by the ministry some time back, there are these 186 districts where there have been no new cases, then they are to be bubble. They are bubbles. So then you restrict travel there and probably restrict travel to those areas where the cases are low. Said that though, Gargi, although the cases are rising and they are going into these Gargutanian numbers, we also know that percentage-wise, probably there will be majority mild and moderate. So the home isolation and the isolation beyond the hospitals should be the target though. And we would have more hospitalization simply because the numbers are so huge. Multiplication by 1.6% of severe cases would also mean that many number of big cases. But then the good thing is that most of the infections will still turn out to be mild and moderate and will still probably need more isolation facilities. So those have to be ramped up. And I think that is being done. And it has to be now at a scale like in a war footing. That's what's needed.
Right, absolutely. An admission of the crisis as well. Dr. Dani, we were talking about how in Gujarat it does seem that, the official numbers are a lot lower than what, we're hearing anecdotally or in media reports, so much so that the Gujarat High Court is taking up a PIL that it's filed on its own today on the healthcare crisis.
Yes, I think it is always better to act early, and the High Court has taken note of that, which is a good thing. I'm sure that the healthcare system in Gujarat should find some new ways to combat this illness or pandemic from going further. And as Dr. Padma Srivastava has said, the way to go is to create bubbles, to provide more home care facilities to more and more patients so that our hospital beds are not overflowing.
Right, Dr. Padma, even as we're in the midst of this, Tika Utsav and the push to vaccinate more, several states are reporting shortages. So again, questions being raised is how did we find ourselves in this situation? We knew that the numbers that we needed to vaccinate earlier on. So why wasn't that organized? Why are states running short of doses?
Yeah, so these are, I'm not a COVID pundit, and I won't be able to, sure, answer out, but just sheer common sense, as a voice from a common, from common people, is that probably when we have taken a leaf out of the history and we know that we're going to hit a second wave. So complacency there that we will not be hitting a second wave probably was not maybe there. And I'm sure the administration had factored in. I'm sure maybe they didn't voice it out because that would create panic again. Said that though, I think it's again the production as well as the rollout. The rollout would still require prioritization, and that's what the entire world is doing. And even though we say that the term Utsav is again probably raising the awareness which would be applicable and much more, that kind of a user-friendly term so that more people would come. But Gagi, when it was rolled out, we all waited for a vaccine. And when vaccine was rolled out, there were very few. There was a lot of vaccine hesitancy. And then there was some vaccine wastage because of the hesitancy. And then when it started rolling out, even amongst the healthcare workers, not very many took it because they were questioning the efficacy, questioning the trials and the time frames wherein they were being, manufactured and rolled out, and even the giving permissions for them to be rolled out. Said that, therefore, I would always say that the responsibility lay amongst even the citizens' community. You didn't take it when it was being given. You didn't take it on day one. And now when you know that there is going to be a shortage, then there is a horde of people and you're looking at a wave, and then there's a lot of people who are coming forward. So you're balancing out everywhere. I'm not blaming anybody. I'm just saying it's human nature that these things happen. But I'm sure this is being looked into, and probably it is just a timeline. We will be able to give that out and roll out to everybody, probably all adults, in fact, not just 45, in fact, everybody after the age of 18 years and even less.
All right. Well, thank you so much, doctors, for joining us right now as India is reporting the highest number of daily COVID cases. The numbers have just been released by the Health Ministry, and India has reported 1,68,912 COVID cases in the last 24 hours. We can go across to NDTV Sukirti now for more. And Sukirti, this is the 6th consecutive day that India is reporting over 1 lakh cases, and now even, God forbid, inching closer to that 2 lakh mark.
Well, yes, a very concerning situation at this point of time that this is the 6th consecutive day that we've reported over 1 lakh cases. And also the number of deaths, the fatality rates are something that we've always been a little content about, that our fatality rate, that's what the government has been saying, that our fatality rate is not as high as other Western countries. Our fatality rate has been extremely low. But deaths also now inching closer to the 1,000 per day mark, with over 904, with nearly 904 deaths being reported in the last 24 hours. And this is India's highest death since October 18,
when we had recorded 1,033 deaths. And of course, the states like Maharashtra and Chhattisgarh continue to be the big worry, with Maharashtra reporting over 55,000 cases, Chhattisgarh reporting over 14,000 cases. And all these central teams that were sent to these worst affected states, they've also pointed out what are the major drawbacks with respect to the state health machinery in all of these states, and the center has asked the states to take steps immediately. But at this point of time, all of this surge in cases, and at the same time, things like the Kumbh Mela seem to be going on without any care in the world. And we've been seeing those visuals of lakhs and lakhs of people gathered in Haridwar, and all of these people then go back to the states that they belong to, and could potentially end up spreading the infection even further. So on one hand, we have the center talking about precautions and measures they are taking and several teams they are sending, and on the other hand, we have these huge gatherings also taking place.
All right, Sukirti, yes, and we're seeing visuals of the ghats in Haridwar, and they're crowded with people who have gathered for the Shahi Snan, and many of the akhadas there taking the dip at the auspicious hour. But imagine this largest gathering. It's, you remember, Mahakumbh is called the largest gathering of humanity in one place at any time, and it's taking place in the midst of this pandemic, in the midst of the COVID crisis, as India is facing the second wave of coronavirus. In fact, one of the Mahants there, Rajgiri, who is the head of an Akhada Parishad, has also tested positive and has been isolated. And here you're just seeing the visuals at the ghats. You can just imagine what the situation is like in the entire city of Haridwar, in hotels, in restaurants, in eateries, in guest houses, absolutely crowded with people from all over the country who will all leave from here and return to their respective places. And many experts have warned that the Mahakumbh could become another super spreader event. Well, with that, time for us to slip into a short break. We'll get you more news on the other side.